name is Leena Palomo. I was born in Washington, D.C., and I grew up in Naperville, Illinois, back when it was cow pastures and cornfields, not the big city it is now. And right after high school, I moved to Cleveland, Ohio, where I got my college education. I went to dental school here. I did my specialty here. My private practice is here. My family is here. And I have a university professorship here. When I heard I had been chosen by the nominating committee to run for director of the American Board of Periodontology, I was humbled and honored. But then I was overcome with a sense of responsibility. I mean, what other profession lets people like me work with the icons of their specialty side by side? At the American Board annual oral exam, I get to do just that. And the icons then of our specialty, they did more than just mentor me. They socialized me into the learned tradition of our profession. So I have a tremendous responsibility to them and to their vision. I also feel a responsibility to the up and coming periodontists so that they can have that rewarding career that the people who built our profession imagined for them, with teaching and lifelong learning, speaking, and contributing to the public. I have a responsibility to them. I also feel tremendous responsibility to the public because there's a public trust involved in board certification. So that, of course, here in America, our public can choose to see a board certified specialist and know what they're getting, that gold standard of diplomate status. But anywhere in the world, if a diplomate of the American Board of Periodontology is practicing anywhere in the world, that confers some level of public trust that this clinician has a deep, in-depth knowledge of the full scope of periodontal and dental implant surgery, and that they recertify so that they're ahead of the curve in terms of new knowledge. I can think of no greater honor than to uphold that gold standard of the American Board of Periodontology. Not just any board, not just any country's, maybe borders change overnight, the American Board of Periodontology, and that is very special. Experiences which prepared me for this position. Well, I have a unique career because I have a private practice in the Cleveland suburbs and I have a university professorship. But my private practice is outside of the university. So I have a very balanced view of the pressures and challenges and benefits of private practice, and also the university view. And they're not always the same. In fact, they're quite different sometimes, with the different challenges of each, the different benefits of each. At the university level, I have the opportunity through my work with CODA to do accreditation site visits for periodontal programs all over America. And so I get to see not only how we do it in my program, but also how the teaching mission is accomplished all over in all the perio residencies in America. So I can see how not just my institution, but all the teaching institutions work towards the teaching mission, and compare it to the private practice, which is a lot different in a lot of different ways necessarily than the teaching component. Another thing that's very necessary when it comes to moving the ball forward for our specialty is a network of people who you can comfortably call and generous people within the academy who share ideas, challenge ideas, grow ideas. So I think I am lucky enough to have that network after working on several AAP committees, notably chairing the AAP Education Committee, and then also through the task force on dental education set up by Dr. Ocano and Dr. Richardson very recently, to look not only at the perio residencies, but dental education in general. Those are our referrals. So that really translates over in a very interesting way from what's taught in the residency programs to what we're doing in our constantly changing environment of referral patterns, patient demands. It's a very interesting way to look at things. But the single greatest thing that I think prepared me for this position is serving in the Joint Task Force on Job Analysis of the American Board. So about a year and a half ago, we assembled out in the desert to actually define what it is that makes a diplomate a diplomate. We actually worked together as a team and constructed that mission statement, that vision statement that I mentioned earlier, that makes American Board of Periodontology status so special. So I think I've been doing the work of the American Board of Periodontology for a while now, several years, through being an examiner, through that joint task force, and through networking. But I think the position of director would give me a platform to do even more for the board. How and why do I encourage board certification? Yes, there's competition as there's an increasing amount of providers who perform periodontal and dental implant procedures. Yes, and it's a financially difficult time after the pandemic. Sure, those things are true, but I encourage board certification comes down to one word: marketability. There's 3 reasons why board certification is marketable. First, it's very, very special. Second, it is very recognized. And third, there is data to support the marketability. So first, let's start with it being special. The reason board certification is so special is because of our partnerships with the AAP, with the ADA, with the Commission on Dental Accreditation, and with third-party payers. We're so special through those relationships. We're so special to those groups that we're considered the special and preferred provider of periodontal and dental implant services. I want to keep those partnerships and strengthen them even further so that we keep being special that way. Board certification is recognizable. You know, our patients are living longer, more vibrant lives, often with medical conditions and on medications. And they are seeking better aesthetics, higher quality of life that comes with the function and aesthetics of oral health. And they go to a lot of other specialty providers too. When they have, you know, a board certified ophthalmologist and a board certified cardiologist, it stands to reason that our savvy patient base is only a Google search away from understanding the mission and the vision of the American Board of Periodontology. And so it is a very recognizable credential. Finally, there is data to support this. And of course, being a board examiner, you knew you weren't going to get out of this without me bringing some sort of reference and data into it. So JAMA published back in 2004 a study of medical specialties. And what they found was very interesting, that the public sees board certification as a non-political, neutral credentialing, which really confers accountability and professional validity onto the board certified specialist. In 2008, there's a publication that's similar, that actually identifies that board certification has marketability. And to me, this is the best time to be, to seek out challenging the board, not just if you're a new graduate, but anybody who's not yet board certified. When we examine, the examiners that I've examined with, they're so collegial, they're nice, they go the extra mile to make everybody feel comfortable. We just talk about a few cases. It's really quite delightful. Finally, the effect of board certification on our specialty. board certification has a tremendous effect on the specialty. As we said, people are living longer, more vibrant lives than ever. They are living these lives with medical conditions, with long-term chronic conditions, and their demands are increasing, both aesthetically in terms of function and the quality of life that comes with great health care, smiles, and wellness. And so we're seeing, as a result, new patient cohorts coming up through. And we're seeing also technology raise the bounds of our specialty, really pushing the limits of what our specialty can do. It's really an exciting time. We have newer, more nimble technologies to communicate with each other, to talk to labs, to talk to referring doctors, to talk and group together and make decisions. We have 3D imaging and surgical planning. The board works to credential and qualify. And so in formulating its questions, in formulating how it wants to pose questions, especially looking at the difference between what we do in private practice and what we teach in our universities, the board has tremendous impact on really defining and growing the specialty, and in that way, protecting it for our future generations and for the public and for the public interest. I can think of no greater use of resources and no better reason for me to roll up my sleeves and keep doing what I've been doing to protect this house. This American Board of Periodontology, very special house. It's our house, and it supports and buttresses our specialty to new heights. I am delighted to run for election for director of the American Board, and I ask for your vote. Thank you very much.